I specialize working with opportunity youth who have experienced educational and professional barriers. So what that looks like is I provide support in connecting these young people to education and employment-focused re-engagement programs that best fits their needs and their learning style. So that includes high school completion programs, GED pathways, internships, apprenticeships, career and college navigation. With my high school journey, I would say that I didn't get much exposure to many different careers early on. I didn't really take as much initiative as others, but given my family's background, I was really drawn to the healthcare related fields because I had many people in my family that were either nurses, doctors, in public health. But it wasn't until I got to college when I started to experience working with these different populations. And also I was able to find a major that fit my career interests. And so during that time, I took more leadership roles. I experienced working directly with young people, went on different immersion trips, and then was also just drawn to public health as a major valued community health. It sort of applied a systems thinking, and it also addressed structural bias and social inequities, which all play such a huge role in an individual's health and in our population's health as well. So I was born in the Philippines, and then I moved to Washington State when I was 4 years old, so I was fairly young. And I grew up in a single mother household with my grandparents. So I faced barriers myself in pursuing an education. I was the first one in my family to go to college. I didn't really have as many resources as others just because of my financial limitations, and my mom and my grandparents, they faced cultural barriers too. So it's kind of hard navigating through these different systems that I had to work with. For example, I didn't have SAT prep. I didn't really understand the financial aid system clearly. So it was really just trying to seek out those different resources and talking to career advisors, talking to peers, and then also like some college navigators as well. And then I relied heavily on a lot of community-based organizations that were kind of providing that support. What I love most about my job is just being able to empower young people, allow them to grow confidence in themselves, believe in themselves, and accomplish those many different paths to success. A lot of the young people that I work with are really, I would say, furthest from educational justice. So just being able to see them earn a secondary credential, even getting their first job, or being the first one in their family to go to college is just a really rewarding part of the job and something that I value very dearly. I had the privilege to work with young people experiencing homelessness. I also worked with young people on the autism spectrum. So I really became drawn to working with young people after those experiences, and it was something that I saw myself doing in the future. The advice that I would give is just to take more initiative, to seek out those resources, especially early on in your professional career. As I mentioned earlier, I was very shy and definitely introverted, so I didn't seek out as many resources, talk to as many people, mentors as I should have. I would definitely recommend taking initiative and seeking out those resources.